The Doctor is In is a family health team in downtown Toronto. 20 years ago, it was a family practice with a single physician, which later evolved into a group practice with 6 physicians and multiple medical office assistants. It has since evolved into a family health team to meet the growing population it serves. A number of new health and social care professionals have also recently joined the team, including a social worker, physiotherapist, clinical pharmacist, dietitian, and a health educator. Johnny is 15 years old and in grade 10. One morning, his high school guidance counselor calls the Doctor is In where Johnny is a patient. He has been talking to Johnny's mother about some concerns that the school has, and at the guidance counselor's recommendation, they have called to book a meeting with Johnny and his family, his nurse practitioner Steph, and the rest of the care team at the Doctor is In. The guidance counselor explains that Johnny's grades are quite low, he is easily distracted, and he shows very little interest in school, usually sitting at the back of the classroom. In the morning, he is irritable and is often nodding off in class. Although he is overweight, staff members rarely see him eating lunch. He mostly seems to snack on potato chips and other vending machine food. Johnny used to be quite athletic and was on the swim team, but he quit about 6 months ago. His parents never come to parent-teacher nights, and he shrugs if he's asked about them. What problems or challenges do you think Johnny is facing? What are the various ways in which these problems might be addressed? Who should be involved at this family meeting? How might an interprofessional team combine insights and actions to effectively deal with this situation? Johnny's mother has booked a meeting with his nurse practitioner, Steph. Steph has also invited senior physician Dr. Goodman, a nurse named Katie, and the health educator, Jamie. The morning of the meeting, Ian, the social worker, notices that Steph has just added him to the meeting. Ian goes to reception to ask Mandy, the medical office assistant, what this meeting is about, as he has no information on this patient. He tells Mandy that he is frustrated and he feels like he's a second-rate professional because he's always brought in last minute. Mandy apologizes for Ian receiving so little notice and says she'll get Johnny's file for him. While Mandy is getting the file for Ian, one of the nurses begins to yell at a new nursing student for putting his backpack behind the front desk. He explains that he has nowhere to put it. The nurse's locker room is for women only, and all of the male employees have their own offices. She says back to him that back in her day, someone like him wouldn't have lasted a week in nursing school. After she storms off, Mandy tells the student he can store his bag in an empty filing cabinet. Shortly after lunch, Johnny and his parents arrive. Mandy notices that the father is slurring his speech and she detects alcohol on his breath. After she pulls Johnny's file, she goes back to inform the team of her observations. The team thanks her and they decide to place the family in the conference room early so as to not upset other patients. The team gathers in the kitchen to have a quick huddle before going into the meeting. Steph, Ian, Katie, Jamie, and Dr. Goodman all show up. Dr. Goodman also brings along a medical student and a resident so they can learn about the medical management of diabetes. Ian asks where Jethro, their dietitian, is. Steph says she doesn't feel that Jethro's presence is necessary. Ian checks with her to make sure he has the right file. When he points out that Johnny has diabetes and his diet seems to be a problem, Steph says that she took nutrition in her nursing degree so she can handle this. The team files into the conference room. Due to all the extra medical learners' presence, there are not enough chairs, so Katie leans against the wall at the back of the room. After some brief introductions from the team, Steph launches into her concerns about how Johnny's diabetes is being managed. Steph is frequently interrupted by Dr. Goodman, either to explain the pathophysiology to his learners, or to quiz them on the medical management of Johnny's diabetes. The topic eventually turns to Johnny's insulin regimen, and Dr. Goodman sends the medical student out to get the pharmacist, Yasmin. Since there are no chairs left, Yasmin leans in over the chairs of Ian and Johnny's mum. Johnny's mother looks visibly uncomfortable and gets up to go stand by Katie at the back of the room. Yasmin takes her seat and continues to explain the use of insulin to the medical student while Johnny plays Candy Crush on his cell phone. Eventually, Johnny's mother cuts them off to raise some concerns about Johnny, particularly the weight gain. Ian asks Johnny how he feels about his weight gain, and Johnny confides that he feels ashamed of his body, and he quit the swim team because he doesn't want to be seen in a swimsuit. Johnny's dad lets out a huff and crosses his arms. Jamie suggests that Johnny could come see him for some educational sessions on healthy lifestyles, and perhaps he would benefit from meeting with their physiotherapist. Ian agrees and offers to collaborate with the health educator and the physiotherapist to help Johnny set and achieve his own goals. Steph says they're also going to schedule Johnny for a full physical and blood work. Ian suggests that the team communicate some of their plans with Johnny's school and perhaps partner with them in Johnny's care. Dr. Goodman says no, that would violate patient confidentiality. How do you think this interprofessional team and family meeting went? Did the team address the problems or challenges that you previously raised? If not, how could these issues have been addressed? How do you think this entire process could be improved?
Created using Powtoon.